It's we're at a time in healthcare, and we always knew we were going to be short-staffed. We saw that coming years ago. We saw an aging nursing population, and we didn't see as many nurses coming in, and we saw a great retirement coming in the future. And we've been planning for how do we work for that, and that's just nursing. That is true across many physicians. It's true across many clinical teams. And then we had COVID, and we saw before we were ready for it, before we were completely expecting it, many people stepped out of the workforce and said, I've kind of had enough. It's too stressful. I want to be done. And we find ourselves in a situation today where we're shorter staffed than we've ever been, and we have just as many patients. And we need to think about how do we do things differently. And that's where automation is one of those things people are kind of used to thinking about when it comes to billing or checking in at the airport. But being able to automate actual clinical work is something that's really new and different. So that's the opportunity we have today, is how do we support those teams? They're working short. There's not people to hire. There's not bodies. That's why we used to problem solve. We throw bodies at it. Well, we can come in and say, help us. We can help you to make your workflows work better so you can manage it with the team that you have. So we start to talk about efficiency. So I'll use the example of the one I just gave you. Go back to the surgery example. Just the intake alone, when you start to think about that, which was 30 minutes per patient to do, 90% of the patients did the form. So, now I times that by 12,500 patients per year. Now I'm saving over 5,000 hours of care in a year that I freed up. I freed up that care. I freed up 2.5 FTEs of people that you were short. I freed it up. I actually made it easier for them to do their work. They're able to manage the same amount of patients with the same team. Actually manage more patients with less burden on the team. And so really, when you think about the monetary value of time, 2.5 FTEs is a monetary value. Now I times that by a couple of nurses, we're saving, just in that one process, you're saving $300,000 a year in time that you freed up. Now, unless I let go of nurses, I didn't have a bottom line, here's my bottom line, but I freed up the team. They were actually able to manage more patients, see more patients that they were already on their schedule, see them faster without being overworked. We freed up that time. And that is truly what people are looking for today, is how you make it easier for me to do my job so I can see all the people lined up to see me, because I can't do it the same way I've always done it. So I call that that's that monetary value of time, and that's efficiencies. With the one hospital we worked with, they wanted to gain 40% efficiency so they could bring in patients. They had 30% of their patients sitting out, being worked up by primary care, and they wanted to work them up in their surgical clinic. And to do that, they had to free up this time. And that 40% efficiency was 60% when we were done. So they actually saw more patients with less burden. And the real beauty of that, I think, is that one of the things we do in healthcare is we create best practice, and then we force every patient through it in the same way, which kind of goes against what we do. But I mean, we act as though our patients are all the same, but we all kind of come with our own baggage. And some patients need more time, and other patients, they're like, I got this, I don't need as much time. But we treat them all the same. You have a 30-minute slot. Well, for the patient who needed more time, if I gave them more time, someone's not behind. And patients aren't happy about that. If I don't give them that time, they're really not getting their needs met. What we do in freeing up that 5,300 hours of care per year, freeing up those 2.5 FTEs, that 67% of the patients move through that process that was very manual before, completely with automation. And in freeing up that time, those patients who needed more time, the patients who are just more complex, or they're a little older, they couldn't do it, they got as much time as they needed, because they were able to have a very high touch process for those patients, and allow the patients who really were a little healthier, those patients who could manage it a little bit better on their own, really move through in a digital fashion. So what we're allowing is patients to get to the state they need to be, which is ready for surgery. But they can move down the pathway in a unique way for them, where it's high touch when they need it, it's low touch when they need it. and everybody gets what they need, which really makes the staff feel much better about what they're doing.